As a practicing gynecologist, over the past decade or more, I have seen a change in the profile of patients that we see or the patients that come to us. And this is a new generation of the IT professionals. Now, what is peculiar about these IT professionals? Maybe peculiar is a wrong word, but I would like to say that they definitely do have a different profile. Their irregular hours, irregular timings definitely in many ways affects their hormonal milieu, and many of them actually go in for irregular cycles. Their time schedules again do not allow them to take part in any exercise schedules that they could join. Their diet is what they get when they get. So most of the time the IT professional canteens are actually flooded with fast food and junk food, which is really not good for their future. Because of career intentions, many women who are in the IT profession actually postpone getting married. And when we talk of postponement, we're talking of postponement beyond 30 or sometimes even beyond 35 years of age. Definitely, without doubt, many conditions can actually come their way. For example, if they plan a pregnancy, natural childbirth or natural fertility itself reduces after the age of 35. Now, certain conditions like, for example, endometriosis can actually become more prevalent as the woman grows older. Because the couple do not sometimes live together, sometimes live in two different cities. It could be Pune, it could be Chennai, it could be Bombay, Hyderabad or anywhere else. Now, perforce they are actually not together, and maybe even if they are trying for a pregnancy, their actual conception may be delayed. When such a woman gets pregnant, her risks of chromosomal problems like Down syndrome, which is also known as trisomy 21, can actually much more. The risk of this condition can be much more. The other aspect of IT professionals that we see is that they actually surf the net for anything and everything. Now, if you actually put a certain symptom into the net, you would actually get access to a number of sites. Now, some of these sites may be actually peer reviewed, some of these sites may be authentic, but many, I'm afraid, may not be. So the information that one gets from it has actually to be vetted. So I personally encourage my patients to go through the net, because the net is a vast source of information. Now, when they actually go through this, I encourage them again to collect the material and to come and discuss it with me, because as a professional, I can then tell them what is right and what is wrong. And when they are armed with the information, they are actually able to understand. Their comprehension levels are definitely much better. And without doubt, being professionals, their level of intelligence is so much higher and they are able to actually understand. I constantly discourage them from going into these chat corners or blogs where people actually put up individual experiences. Now, individual experiences, I always tell my patients, we ourselves, even though we are professionals, would never talk about happy things to people. We would always discuss only what goes wrong. So the same applies to anyone. For example, I would actually sit at a system and type something that went wrong with me, but I would never say that I have this experience, I have taken this drug or this medicine, or I have undergone this particular surgery and I am actually doing well. Now, that is not common. So the net is something that has to be taken very, very carefully. We have to say everything that we read there has to be taken with a pinch of salt. So my main message to all of you is that, one, try and plan your lives. Plan the age when you would want to get married, when you would want to plan your family. There are many number of methods that are available if you want to postpone a pregnancy. See your gynecologist and take advice about this. And when you actually start trying, give yourselves a year or maybe two, and if you do not conceive, I would suggest that you go and meet your gynecologist. And again, beware of information that you get from the net. Please always go and talk to your gynecologist, who I'm sure will be very happy to discuss it with you.